We get started just in the interest of time. My name is Andrew Schroeder. I'm the Vice President for Research and Analysis at Direct Relief, and I'm really happy to invite everyone to the inaugural panel discussion for the CrisisReady project. Just wanted to say a couple of quick words about CrisisReady before we get underway. CrisisReady is, in many ways, it's an outgrowth both of, work that's been done for a number of years now around applications of large-scale data analysis to key problems in disaster relief and public health emergency response. It was really catalyzed by the COVID epidemic. And the creation of the COVID-19 Mobility Data Network, where a number of us from the academic community, the infectious disease epidemiology community, the nonprofit public health emergency community came together to utilize digital mobility data in privacy protected ways to inform public health policy and response to COVID, principally around social distancing. As we've seen, we now live in a world where disasters happen simultaneously all over the country. It's been quite a year throughout 2020, with the wildfires in California in particular, I think, being center stage for many of us around the crisis of climate change, the impact that disasters are having throughout some of the most vulnerable areas of the state, where the strengths of the contemporary health system in California, where we've gotten new technologies, new kinds of healthcare applications that have been a real advantage in many ways, also have created new vulnerabilities where power outages and other impacts to health infrastructure have made it so that many people have been newly vulnerable to rolling power outages through the wildfires, and where we've seen that accelerated by the COVID epidemic and with the smoke plumes that have accelerated respiratory distress and other kinds of health impacts for citizens throughout the state and really throughout the country, as we've seen the smoke in particular impact the entire country. I think I should probably turn my camera on. So we're really happy to have a group together here to be able to begin addressing that. And CrisisReady is our response to this moment. It's a collaboration between Harvard School of Public Health, and Satchit can say a couple words about that if he would like. Satchit Balsari, my colleague from Harvard, is on now, and Direct Relief. We envision it as well as a network of experts that are working throughout the country and throughout the world to address these kinds of problems. Satchit, did you want to say any introductory words to?
And thank you all for joining us today. As much as we will speak about the California wildfires, this work really builds off of the work that we've all collaboratively done in the COVID-19 Mobility Data Network, in the sense that I think we've consolidated this realization that we need to work on three aspects of bringing evidence-based decision-making to disasters, and that's the data readiness, methods readiness, and translational readiness platform that we've talked about over and over again. And I think the California wildfires and the speakers that we hear from today help underscore the need to work on each of these, right? We've spent the last year talking about the struggle with these data, the representativeness, the need to develop methods. But what we'll also hear about today is really the translational piece. What is CDPH thinking about it? What are the affiliated agencies thinking about it? What is EMS? What is Cal OES thinking about response? And especially the vulnerabilities angle. I think I must confess that when we started thinking about vulnerable populations in California for the wildfires, our focus was narrow, it was clinical. We were focused on patients with electricity dependent medical equipment, sort of just a narrow section of DMEs. and very quickly broadened to thinking about food insecurity because of the early inputs we got from several people from CDPH and CCLHO. And then realized, there are whole populations where vulnerabilities are related to their physical mobility associated with other disabilities, the elderly who don't have the options to move, and so on and so forth. And very quickly, you sort of recognize there are so many different subsections of society that we need to start thinking about. I'd very much like us to maximize the time we have with our four speakers today. So I'll pause there. Andrew, thank you for the introduction, and thank you all for joining us today.
Excellent, thanks, Satchit. So the topic today is on data, equity, and wildfires in California. And we have a group of people that are, I think, really well poised to address this and to set the research agenda for us going forward. We'll be joined by Vance Taylor first, who is the Chief of the Office of Access and Functional Needs at the California Governor's Office of Emergency Services, Cal-OES. Vance will be followed by Jason Vargo, who's a research scientist at California Department of Public Health, CDPH. We will have Joan Casey from the Environmental Health Sciences group at Columbia Mailman School of Public Health, who will be talking about the GETTY fire and dementia. And then Mathew Kiang will finish us off. He's from the Department of Epidemiology and Population Health at Stanford. And Matt will be talking about where we're at with this work and where I think the agenda goes from here. So without further ado, I would like to turn it over to Vance Taylor to lead us off on questions about access, functional needs, and the impact of the wildfires on vulnerable patients throughout California. So Vance, I see you.
Yep, hey, there you go. Hi, Andrew, how are you?
Great, thanks for joining.
Yeah, absolutely. Hey, so I'm glad to be here, and what a great topic. As you know, this is something that's near and dear to my heart. I'm very passionate about. Just by way of background for everybody. So my name is Vance Taylor, and as Andrew said, I serve as the Chief of the Office of Access and Functional Needs at the California Governor's Office of Emergency Services. Which is a very long title, but that's kind of the way that, I don't know, state service works, I guess. So just, in terms of, I think, background or context on this issue, it's really important to point out that what we've seen historically is that individuals with disabilities, and really anyone with an access or functional need, is disproportionately impacted during any disaster. And Hurricane Katrina really put a bright light on that, right? Because it was during Hurricane Katrina, we saw that out of everyone who perished, 70% of all the people who died had an access or functional need, right? So what does that say about the way that we've traditionally planned, prepared, responded, or recovered with that access and functional needs in mind? We haven't had that perspective. And what you've had is good people trying to do good things, but it's important to recognize that most emergency managers, you have a lot of first responders, or former first responders, law enforcement, former military, but usually those individuals don't have a lived experience in the access and functional needs realm. And so, for example, I use a wheelchair, and when I go into a room, I'm automatically, really almost at a subconscious level, scanning that room for access. Can I fit under the table? Are the aisles cluttered? Are there stairs? And that's just because that's my experience. But if you don't use a wheelchair and you don't have a mobility challenge, chances are you don't think about those things when you go into a room. Well, that's how it was working with our our planning is planning took place from one perspective. And so recognizing that, hey, there's this disproportionate impact, there's a limited perspective, California decided to lean forward and try to get ahead of this. And the governor created the Office of Access and Functional Needs and made the position of chief as a senior level executive to brief the director of OES and the governor on where we were really on sort of this twofold mission of one, identifying what are the needs that people have before, during, and after a disaster. And then really after we wrap our arms around that, the second fold, which is integrating those needs. And that's where data plays a really important part, is that right now we don't really, if you were to go to the communities in California, for example, and I will say just on the outset, California, I'm very proud of the work we've done. As a whole, California leads the nation in things like inclusive and integrated planning. But we're definitely not ready to hang the mission accomplished banner yet, right? There's more work to be done. And part of that is understanding our communities better. And so if I were to go to one of our 58 counties and ask how many people are going to require accessible transportation resources to evacuate during a disaster, chances are that county can't give me that info. So the ability then for that county to plan properly doesn't exist, right? They don't know how to plan for the delta between, well, how many people need an accessible resource and how many resources do we have access to? And that's kind of the way that it works on most of the accessible resources that people are going to need in order to be safe, healthy, and secure. They're not going to be able to maintain their independence unless we can get more granular data on this. And for a long time, it's been said that the data doesn't exist. And I don't believe that's true. What I found is that the data does exist. It's just that it's spread out across a lot of different organizations, right? Some government, some private sector, lots of CBOs. And what I'd like to do is, you know, my vision for this is to be able to essentially create an AFN database where you can find a way to pool all those different data sources into a data set that then can be used to enhance the way we plan and respond, right? So that instead of wondering how many assets and what type of resource are we going to need, that based on the understanding of who lives in our communities, that we'll know that ahead of time, and we'll be able to make arrangements and investments accordingly, and that will make informed decisions based on that data. And that data can be utilized in real time to improve and enhance the way we do everything from alert people to send transportation resources to staff and provide services at shelters. When we talk about things like emergency alerting, you know, it boggles my mind that Alexa can tell me when there's a package at the door, but she doesn't tell me there's a red flag warning, or Siri doesn't tell me there's a mandatory evacuation order. And I can't use those resources to have somebody send me emergency transportation. My smart TV doesn't automatically turn on in the middle of the night to an emergency press conference. The lights in my smart home don't flash on and off to let me know in the middle of the night that there's an emergency. You know, why is it that my Google Maps or Waze doesn't automatically populate to tell me where the evacuation route is, right? It's not that these capabilities and the technology to do this don't exist. It's that we haven't innovated or been innovative in the way that we've used the existing technologies or capabilities on this front. But the ability to do any and or all of that really relies on our ability to get data and to utilize and leverage that data. So in fact, there's a big gap right now, but the great thing is that we're recognizing that gap. We've got teams like CrisisReady that are actively working to shore up these gaps. And then once we can cross that bridge, what we can do with that is really limitless. You know, we're at that point, we're only bound by a lack of imagination. But you know, look, it's 2020. You know, we're past the point where any of us should accept that someone's going to die in their home because they lack the ability to run for help. And ultimately, this is what we're talking about. That's what this data issue is trying to solve. So thanks for the work you do on that front, and thanks for letting me share some thoughts.
Thank you very much, Vance. That's fantastic and very well said, I think. And I think we'll save questions for the end and try to integrate across various folks. So I'd like to maybe follow up what you were just discussing really well with Jason Vargo, who's going to talk about equity issues and the public safety power shutoffs. Jason?
Hi there. Thank you for having me. My name is Jason Vargo. I have a much shorter title for my state service, but I'm a scientist in the state of California, and I work on health equity issues. I used to work in the climate change and health equity program at CDPH, and but I've since been redirected to COVID, and so I've been working on that a lot. And most of the things that I'll show you today are work that I did with the climate change and health equity program here, and really relate to some of that translation, trying to translate information that we have about fire, about smoke, about power shutoffs, and about underlying community vulnerabilities and how we combine those and sort of we've begun to socialize them and integrate them into policy and investment strategy. So I do have some just materials I want to share. I'll try to go through them as quickly as possible. So hopefully you can all see that. So as I said, there's several different ways that we talk about wildfire and equity in California. And really the first is about where fires are expected to occur, the real fire hazard. One of the things that I think the climate change and health equity program did early was recognize that there are a number of underlying community vulnerabilities that are going to be sort of brought to the fore as climate change continues. And I moved here from Wisconsin, and I did move here 2 years ago, and almost every year we've had huge wildfires, and I just felt like climate change is so much more real out here in California, and I feel like the future is happening here first a little bit, to quote our governor. And but we saw in huge wildfires in 17 and 18 that the elderly and disabled were more likely to die in these fires. So the fire hazard presents an injury threat, an evacuation threat, and some of the concerns that Vance just talked about. And one of the things that we did in the climate change and health vulnerability assessments that our group produced was to try and combine these environmental data sets with people. And so that's really like the first principle I would say about translating some of this, is to take this environmental data about where things are happening and what is happening on the ground, and then combine people and bring people into that. So bringing in data about the underlying communities, combining that with information from environmental science about fire hazard was really something that we tried to do with our climate change and health vulnerability indicators. So we could highlight where we have communities with higher proportion of the population living with a disability and also have a high fire risk. And we were happy to see that sort of picked up by CAL FIRE. One of the first executive orders that Governor Newsom passed was to produce this 45-day report. And in that, CAL FIRE did take some of our recommendations, some of the underlying population vulnerability characteristics that you can see here in this table 1, and put it into their schedule for investments and planning moving forward. So when CAL FIRE went forward and did these projects about fuel breaks, and they prioritized communities that were at the greatest risk or had the greatest vulnerabilities according to these characteristics that we helped define. So that's one way that we've really introduced people to that equation about planning for fire hazard. The next way that I think about the health impacts of wildfire are really around smoke. And so what we've done here is we've tried to develop a database of sort of historic wildfire smoke exposure to really begin to track it, to understand which communities are experiencing more smoke or less smoke, sort of cumulative impacts of smoke exposure over time. We've made use of obviously monitored data, like the points on this map, but also brought in satellite imagery about categorical wildfire smoke that's drawn from visible imagery, as well as satellite detected fires on the ground, and categorized as heavy, medium, and light. This was a really first done by some colleagues of mine in the environmental health investigations branch, but they looked at the 2015 wildfire season and used these categorical satellite derived plumes to demonstrate increased risk of cardiovascular or cardiac arrest and cardiocerebral attack. So we began to sort of just inventory this database over time and combine it with population and look at it in a couple different ways. So what that allowed us to do is sort of make statements like this and understand how many days and people are under these different smoke plumes in a given year. In 2018, we estimated about 260 million person days in California. Sorry to say that in 2018, we already have about 815 million person days in California. That's just for California. We can also look at this over time, and we see the trends are just increasing. So from a climate change perspective, I mean, this type of longitudinal data about the impact of wildfire smoke is really important for the population of California and of the entire nation. So as Satchit said earlier, the smoke that's been happening out west this year is really impacting many parts of the US. So you can see here during September in that peak, over 200 million people in the United States were under heavy smoke plumes. So that's a majority of the population at the same time. And one thing that we've tried to do is not only integrate it with population to get metrics like that person days of smoke exposure, but really try to begin like what are the underlying vulnerabilities again of people that are experiencing more of these days. So once we understand the exposure a little bit more clearly, then we can begin to understand what are the underlying population characteristics that are making the vulnerabilities that might be exploited by this hazard. So one thing that we did with the data set earlier was we tried to look at the CDC's social vulnerability index. So in this case, you see outlines of the counties that are in the bottom or the most vulnerable quartile for each of the 4 characteristics that are in that vulnerability index. And we found that in the West, especially where we saw sort of more persistent and chronic wildfire smoke exposures, we had this, we found linguistic isolation to be more important to defining vulnerability. We found non-white populations. We found housing characteristics like crowding and housing burden to be really important. And so combining sort of strategies that make progress on the housing issues that we have here in California with wildfire smoke exposures might be a really important strategy. That really only came about once we were able to combine information about population vulnerability with this environmental hazard related to wildfire smoke. And we can go even further, I think. So this is an example that I use about a policy that was put forward within the California Assembly to do a pilot project to upgrade ventilation for vulnerable populations. And one thing that we could quickly do is begin to really understand specific characteristics of the populations and where those characteristics that we're most interested in, say, for example, low-income school children that we might want to prioritize through a pilot project like this, where those characteristics are intersecting most with wildfire smoke exposures over time. So when we look at that, we could immediately highlight, opportunities or priority areas where this pilot project should be prioritized, because we know that we not only have more person days of smoke exposure, but we really have, a specific person day. In other words, we have children in poverty person days of smoke exposure in particular parts of the state, and we can prioritize that pilot project in those schools. The last area that we've really focused on is sort of how are the actions that we're trying to take to adapt to a changing wildfire regime. What are those actually doing? Are we having these unintended consequences where we're trying to avoid wildfires, but then putting others at risk, new risks, by, for example, shutting off the power? And so this is the public safety, the quote unquote public safety power shutoffs, but we've been told, as Satchit said in early meetings with the CCLHO, communities don't really see these as public safety issues. They just see these as power shutoff events. They don't feel safer necessarily when they have to go without power for 5 days. So excuse me if I slip into my PSPS language, but I intend to sort of honor their perspective and refer to these as power shutoff events. But we're really trying to look at, again, bring in these equity indices or underlying community vulnerabilities and understand where's the overlap between where the power is being shut off and what vulnerabilities are being sort of emphasized in that event. So one thing that we've done with Satchit and Mathew is to look at different events from 2019, for example, and begin to try to understand what some of the characteristics of those are. And what we saw was, at least in the case of 2019 with Northern California shutoffs, there's very different levels of disparity between the communities who are impacted and those who aren't, depending on where that shutoff occurs. So not all shutoffs are necessarily created equal. So we see more frequent shutoffs, for example, in small sort of foothill hamlets where we have high concentrations of poverty and disability. And so those are sort of smaller events that might not make the headlines. It might not affect downtown Santa Rosa, and it might not get as much attention, but those are happening more regularly and impacting those communities more persistently. So bringing attention to that is something that I hope we can do with our work. The one thing I want to say is that we're using more and more of this Healthy Places Index to understand equity and vulnerability in our communities. This is a California specific index. It combines 25 different indicators and puts them into an index that's associated with life expectancy at birth. It's been really helpful for us. And then we're also sort of using that to combine with methods that have been pioneered at Harvard School of Public Health and Nancy Krieger, looking at the Harvard Geocoding Disparities Project. So one thing that we've done is we've really tried to intersect these community level assessments of population characteristics or community characteristics with hazard in the case of climate change, but in the case of COVID, we look at it and we describe case rates by these underlying community, what the Harvard project refers to as ABSMs, or area-based socioeconomic measures. And that's been really helpful. We've begun to socialize that idea up, and I'm proud to say that recently we actually used this Healthy Places Index, a health equity index, in a policy framework for reopening the state of California under COVID. So that was I think it was a real step forward in terms of using an equity lens and tying it to policy, and letting data and science sort of inform the direction that we're going in responding to a crisis. So I'll just recap with a couple of my thoughts. It's like, first, I think that the big part, in some cases, the Department of Public Health has been really helpful for natural resources or maybe environmental organizations at adding people to the science of other disciplines. So combining information about fire hazard with populations. And then we oftentimes will start with these general health equity indices, like the social vulnerability index that I mentioned, or Healthy Places Index. And then when the opportunity presents itself, or when questions arise about specifics, for example, in that school pilot program example I mentioned, then you can drill down into look at very specific characteristics of community vulnerability and answer more specific questions. And then finally, trying to understand these unintended consequences of our adaptation actions. These are some of the frontiers, I would say, of the work on wildfire and equity in California. So I'll stop there and just thank you for your time.
Thank you very much, Jason. Really important work. And it's, I think, one of the missions of CrisisReady to make sure that to the degree possible, we can help to advance the kinds of things that you're talking about and participate in boosting the science in the state. So, more of these goals are achieved. I wanted to bring to the fore then next Joan Casey. Joan, are you there?
Hi, yeah.
Hi, Joan. How you doing? Welcome to the meeting.
Thank you. Hi, everyone. Let me just get my screen share going here. Hopefully it will launch up shortly. All right, great. Just checking that you see my slides.
Yep, looks good.
Okay, fabulous. Okay, so thanks for those two prior talks. Really, really interesting. And I'm going to now kind of drill down into a specific example of a little bit of work we've been doing in Southern California. And today I'll talk about the 2019 GETTY fire and a specific vulnerable population of older adults living in Southern California. So here's where the GETTY fire occurred, very close to Los Angeles, folks might remember from last year. And this was a particularly interesting fire. It only actually burned about 800 acres, but compared to many of the other fires we've seen in California, it occurred much closer to population centers. So you can see the firefighters here and Los Angeles in the background. And so this fire actually ended up having potentially large health impacts just due to its proximity to human populations. We wanted to look at this related to health outcomes. And so we partnered with Kaiser Permanente in Southern California. So they have clinics, as you can see, denoted in blue and orange on this map across the region. And in particular, we wanted to look at folks that had a previous dementia diagnosis, because we thought this might be a really vulnerable group during a wildfire. It might be difficult for folks to evacuate. It might be difficult for them to understand wildfire warnings. And they also might have other comorbidities that make them more vulnerable to particulate matter from these wildfires. So we identified from Kaiser anyone that had a dementia diagnosis in the year prior to this fire, and that was over 25,000 people in Kaiser's catchment area. So we used their electronic health record, and I just wanted to mention kind of why I think this resource will be increasingly valuable as we want to study large vulnerable populations in the context of climate change. So we have these EHRs that cover at Kaiser over 4.5 million patients, and it provides, their full healthcare record every time they interact with the system. We can, really quickly query large numbers of people and get at their information. And then because healthcare providers are very fixated on billing their patients, we know exactly where people live over time. And so patient addresses are really, really well maintained. So we're able to link in space and time different exposures such as wildfires. So again, here's kind of the boundary of the Getty fire. You can see it's very close to Santa Monica. It kind of abuts the Brentwood neighborhood, which is a really wealthy neighborhood in the LA area. And so related to this fire, we were really interested in kind of two different exposures. One, Jason mentioned, was wildfire particulate matter, which we know can be health harming. And then we were also interested in trying to characterize kind of a stress pathway exposure of people living in an evacuation zone or thinking they might need to evacuate due to exposure to this fire. And so we created kind of two different exposure metrics. One, we used satellite imagery and some counterfactual modeling strategies to estimate levels of wildfire PM. I'm not going to get into that today. That's a whole nother story, but this is just to show you kind of wildfire PM in the region over time. And you can see quite a large spike in wildfire PM during the Getty fire, which comes as no surprise. And then we were also interested in identifying zip codes that we characterized as disaster exposed. And so to do that, we just used a proximity metric to the wildfire boundary. So any zip code within 20 kilometers of the Getty fire, we defined as disaster exposed. And so you can see those located in the lighter blue region on this map. And then the darker blue region was our comparison population. So we did a difference in differences analysis. Folks may be familiar with that. This was a analysis at the zip code daily level. So we had counts of healthcare visits among people with a prior dementia diagnosis in every zip code that Kaiser served here. And then we used two differences to try to isolate the effect of this wildfire disaster exposure on healthcare visits. So the first difference was among the disaster exposed zip codes. We looked from the change in healthcare visits from the pre to the post period. And then the second difference was among the disaster unexposed, so all those zip codes not highlighted in pink, the difference in healthcare visits from the pre to the post period. And then by subtracting those, we could effectively isolate what we thought the effect of living in a disaster zip code during this wildfire was on healthcare visits among people with dementia. So here's kind of the average daily visits per zip code, split up into, in blue, the disaster exposed zip codes, and the maroon, the non-disaster exposed zip codes over time. And so in this final adjusted model, essentially what we found here was that it looked like the Getty fire disaster exposure was associated with about 0.5 additional healthcare visits per day among individuals with dementia in each zip code in the month following the fire. So it looked like there may be this actual uptick in healthcare visits, which was pretty interesting because for many healthcare visits for many other populations during the fire, we actually saw a reduction in visits. So some preliminary evidence there. We're now planning to move on and look at many additional fires. So all the fires that occurred in Southern California between 2008 and 2018 or 2020 among this dementia population, and thinking about both short-term and potentially long-term effects of being exposed to wildfire PM, as well as this disaster exposure or evacuation exposure. And so with Matt and Satchit as well, we're working further on characterizing kind of communities that saw evacuation or that there was a high degree of mobility during fires and what that might mean for health. I just wanted to finish talking about some of the particular reasons we're interested in older adults related to wildfires. So one is access to care, and that older adults in general just need a lot more care. For example, there are interventions, things like pre-dialysis or medication fills. If we know that there's going to be a risk or one of these preventive power shutoffs, or yeah, I liked the way Jason was phrasing this, that this is just a power shutoff, not necessarily related to health. And so starting to think with healthcare systems about some of these preventative measures that can be taken ahead of time will be quite helpful, especially among the group of people that's reliant on electricity-dependent medical devices like Satchit was mentioning. We've done some preliminary work at Kaiser around this group of people that uses electricity-dependent medical equipment. You can see the rates of use among older adults are at least 3 times higher than any other group, although most of these groups actually are increasing in their use of these devices at home over time. So I think will continue to be really important to characterize and study. Also, older adults have actually may be better off in terms of social support. There's some evidence that they have more social support, and this may help them respond to a disaster, but something critical for us to think about. And then there's the ability to evacuate, especially among groups such as folks with dementia. So older adults might be more reluctant to evacuate for a variety of reasons. And this sort of evacuation can also fragment social networks. So all of this kind of starts linking together. There's this issue that among older adults, cognitive impairment might interfere with risk communication. So thinking about how we're going to actually talk to this group, get them the information that they need. And then remembering that this is, a very heterogeneous group. Some older adults are super self-sufficient, maybe helping others during wildfire disasters, and others might have multiple comorbidities and need much more additional care. So I'll just finish up by saying that we know that disasters and wildfires in particular in California are likely to increase in frequency and severity. We know that the size of the older adult population is growing. And so to protect the health of these populations, we need to start integrating social and environmental determinants of health, because neither can be studied without the other in the context of climate change. And so it's been great to hear a little bit from Vance and Jason about steps that are going on in California to this end. So I will just end there. So thank you very much for your attention.
Perfect. Thank you so much, Joan. Yeah, I remember the Getty fire very distinctly. Let's hope that there isn't another one right downtown there. The last speaker I'd like to bring up is Matt Kiang from Stanford. And Matt's going to talk about where this is going, research agendas, and how we've been thinking about this. Matt?
Thanks, Andrew. Can everybody see the slides? Yes. Yep. All right, cool. So I want to be mindful of time, so I'm not going to go through every slide in detail, but I just wanted to give a broad overview of sort of what we're thinking about, and then close with sort of the projects that we have sort of in the near term horizon. So this is like a big problem, right? So I think everyone sort of spoke to the problem here, and this is just the 2020 fire season up until earlier this week. And I'm highlighting the active fires that have burned more than 100,000 acres, right? So it's a huge problem in California. I think it's hard for, often hard for others to imagine it, but it's fairly massive. And just to give you some sense of how massive, I'm gonna highlight sort of these 3 big ones that all occurred at the same time due to the same lightning storm in the Bay Area. And so the red are the fire perimeters, and these are days. So the leftmost column is August 17th, and then I go every other day for 10 days. And then the rightmost column is the last day of data I had, so last week. And you can just see that the fire very sort of rapidly increased in perimeter size around the Bay Area. So this is all Northern California. It just rapidly increased, and even now, 8 weeks later, there's still fires going around. And then I highlight for every row, I'm highlighting different evacuation orders. So the top is the August fire and the counties that evacuated there. These dots just show you the people who were displaced. So we had them located in those counties and now they're no longer there and where they went. And you can see that the dynamics of the fires, sort of the mobility dynamics of the fires sort of differ widely. So in the bottom row, you have the SCU lightning complex, where people even now 8 weeks later seem to still be displaced. And in the middle, you have the CZU complex, where it seemed like fairly rapidly people displaced and went back home. And so we're thinking about things. So in the context of California, we need to think about, well, who are these people who are displaced? Where are they going? And these on the left here is Medicare beneficiaries, and on the right is Medicare beneficiaries with electricity dependent medical equipment. So who are these at-risk populations? Where are they going? And as Satchit said, when we started thinking about this early on, it was really about medical vulnerability. And as we've spoken more with CDPH and CalEOS and all of the California acronyms, we've like learned that we need to start thinking more about the social aspect and the wraparound services as well. But this is sort of where we're starting, is where the medically vulnerable, and then where did they go? And so this is hospital locations on the left and nursing homes on the right. And this is sort of central because this is not only where people are going to end up, but also these hospitals often get evacuated. So the year that we started this, there was I think it was a Kaiser that got evacuated, and then the next day, so they shipped all their patients to a different Kaiser, and then the next day got evacuated again. So surely we can do better, and we can think about better ways of evacuating and sending people to different locations. And so all of that to say, this is sort of where we are now for the next sort of 6 to 18 month horizon in terms of questions. In the immediate future, we're doing a qualitative study, right? So we've talked to the people in California, but we need to talk to on the ground people who've been affected, as well as sort of the people who are running shelters and FHQCs and clinics. What are their needs in terms of what can California do? What can we do in supporting them? And then what are just the general mobility dynamics of wildfires? How far do people go? I think we looked at the preliminary data and I was sort of shocked at how rapidly people went home and just how close they stayed to the fire boundary. So we need a better understanding of this. Where do people go? How often, how quickly do they leave? When do they come back? I think Vance talked about this earlier, but what makes evacuation orders more or less effective? And so we're seeing that different areas seem to be leaving at different rates, even though they get the evacuation order at the same time. So why is that? And what can we do to improve response to evacuation orders, or I say PSPS here, sorry, Jason, but or preliminary power shutoff events. And then working with Red Cross and HHS, we want to know, well, can we better predict shelter placement in terms of these fires? Specifically, not just where should they go, but what are the surges they expect and what are the medical needs that will likely show up? And then all of this will just be generally for both the shelters and medical clinics. Can we tell not just the fire perimeter, but as Jason mentioned, the smoke, and as Joan presented, the smoke, where are they going to go and what are the medical needs that they're going to present? And so these are some of, but I think the ones that we're most excited about right now in the near term projects that we're looking at. And then I want to leave enough time for discussion. So I'll just conclude by saying that we're hiring. And so if you have anyone in your network who might be interested in any of the questions I just talked about, please send them our way. But otherwise, I think we had like great speakers. Thank you everyone for speaking, and I want to leave time for discussion, so I'll turn it over to you, Andrew.
All right, perfect. Thanks, Matt. I also wanted to acknowledge that our colleague Alex Diaz from Google.org is here, and although we're not going to talk about it today so much, we have some exciting things to announce coming up with Google.org, who've been really strong supporters in this space and have done, I think, quite a lot, particularly around the new wildfire perimeter work and with emergency alerting, which Vance actually, and Joan in their own ways called out earlier. And I don't know if you want to like say anything, Alex, about Google's approach towards some of the wildfire data issues lately. I'd be happy to have you join.
Thanks, Andrew. I'll cede the floor for discussion. I don't want to take up too much time. Thanks for the shout out. If folks have questions, I can drop my email into the chat.
Okay, perfect. All right, so let's start by talking. Well, first of all, asking whether anybody has any specific burning questions that you'd like to lead off with. Otherwise, I can jump in. I wanted to kind of pick up this thread around data, actually, that started with what Vance was talking about at the beginning, about data exist, they're just unevenly distributed and not integrated. You know, for Jason and Joan and Matt, I mean, you all, you know, took up, I think, variants of this question in different ways. But, you know, as you've kind of looked at this, you know, where are the real data gaps at this point, and where are the priorities, you think, around, you know, what kind of data we need, how we need to be bringing it together, and what the you know, sort of like most significant focal points there are going to be?
I'll just briefly say that, I mean, we've tried to use we've used like fairly dumb data, for lack of a better way of describing it. I mean, we're using like the census data, some of this data that is in satellite, which isn't like describing concentrations of particulate matter. We're just trying to sort of like bring some attention to the problem, quantify it in some way. But certainly around the mobility data, the digital divide that we see within the state is sort of exposed, and we saw that with COVID, especially when we tried to use mobility data to monitor these non-pharmaceutical interventions. And I mean, some of the fires that Matt mentioned are like, they really benefit from the amount of data that exists in like the tech savvy South Bay, and it probably assists in that type of analysis, you know, where you're looking at like displacement and people moving away. But certainly in some of the foothills, you might not have as many subscribers to different applications, or using like location services on the phones that might feed into mobility data. So I think that data divide, with some of the more sophisticated new big data, it might be more exposed.
Yeah, I would just say from a health perspective, one, doing studies where we actually delineate social categories and try to characterize different outcomes among different groups is going to be really important, because so far, basically, all of the health studies show there was a wildfire, air pollution went up, we saw more emergency department visits. That's basically the literature to date on wildfires. And so we're clearly missing critical heterogeneity in how people are affected. When you think about who can afford to evacuate, who has a second home, who can buy air filtration systems, who still has to go to work every day, even if there's horrible air quality. There have to be differences. And so starting to catalog those so that we can start intervening will be really important. And I loved the question Matt posed also about what makes evacuation orders or power shutoff warnings effective, because I think evaluating our interventions and seeing how that changes health outcomes is going to be a really important next step too, in terms of this communication piece.
I just want to say that, so one of the things that I think we don't do well is collect the data in a way that's like shareable and usable. And even the exposure data itself is sort of not great, right? And so one of the stories, the first stories Satchit and I heard when we were in Sacramento talking to California, is that we were just trying to ask them, where did the shutoffs occur and when did they turn back on? And the police chief told us that PG&E sent somebody to his house to turn on his power twice, and his power never went out. So even the utilities themselves don't really know. And I think Joan and Satchit, I don't think I can say which company, but we're working on a way of like better estimating even very basic things like power outages. So even though there's a lot of data, it's not clear that it's all usable or useful. So I think there's a lot of work to be done there.
Absolutely. And Vance, did you want to weigh in on any other, like, what's your top request for data that you'd like to see integrated? I know you kind of mapped out a number of different things that might be priorities, but if you wanted to throw something out to the community to really address, what would you want to prioritize?
Yeah, I mean, I think in a PSPS environment, you're probably it's good to focus on people who depend on power. It seems to me that if we can identify people that require power for life-sustaining medical devices, and then be able to plan and prepare accordingly to meet their needs, that probably we're going to be much better prepared to address and meet the needs of everyone else that's going to be considered to be in a traditionally vulnerable population. Part of the challenge there is that I think Mathew was speaking to this, that the IOUs really don't know their customers, right? So even they have medical baseline lists, but that medical baseline list is pretty generic. It's a very small percentage of the people that are even eligible for it. They actually sign on to it. And so when you ask them that you're going to shut off large swaths of power, who exactly is impacted and what is the impact? They don't have a way to answer that. And until there is a mandate for them to do so, I think that gap will continue to exist unless it's failed or addressed by an outside entity.
Mm-hmm. Absolutely. Just really quick from Direct Relief's point of view, I mean, one of the things we've been really trying to understand better is the distribution of power resiliency in the primary care network. One of the things that we've found is that, backup power, the ability to do, even just targeted backups for key medical resources in facilities is highly unevenly distributed around California in ways that deviate from even Puerto Rico in our experience with Hurricane Maria, where in part because Hurricane Maria in Puerto Rico hit an area that was used to having a relatively unstable power infrastructure, there were actually more distributed, localized backup systems, which have subsequently been improved. The same was not actually true in California, in part probably because people have relied upon the grid being relatively stable for a long period of time. So as that changes, there's a real high incentive to change the resiliency structure of the state around critical medical facilities. Hospitals are sort of a different issue, but when you get into FQHCs, free and charitable clinics, and other aspects of the primary care network, it's important to get out ahead of some of these power resiliency issues and start planning for what are the costs of transition going to be towards a much more reliable power structure for even just at the facility level, not even getting into this community question.
Well, and Andrew, just real quick, I think as a utility gets smarter with microgrid technology and other technologies, their ability to be able to be more surgical in the approach of, my house stays on, the next door neighbor does not, as opposed to this entire set of city blocks goes down, right? Or anyone on either end of the line that gets de-energized is out. That's why you get 9 counties that go down at the same time, even though the wind that they're concerned about only impacts maybe 2 areas along that line.
Yeah, absolutely.
I think the microgrid is a really interesting approach that isn't discussed as much as I would like to see it discussed, but certainly the targeting of the shutoff is one thing, and then sort of just reducing the number of these high transmission lines, which are in large part the reason that the power is being shut off often, to avoid those going down and starting the fires. You know, a distributed system would help to reduce those types of infrastructure altogether.
And again, when you're looking at, okay, well, if you're a utility and you're investing, how do you prioritize? Having data on which customers need what will inform that process. Then it should be based on the health and safety needs of the customers you serve, as opposed to maybe a different approach.
Absolutely. I want to acknowledge that we are at time now, and to thank everybody. I thought this was a fantastic panel. I always learn so much from this group, and there's a lot more to come. There's a set of, as Matt laid out, really, I think, important research questions that are going to be followed up in depth over the next year and into the future. And we're hopeful that partnerships which bring together the best of the nonprofit, academic, and public sector communities can be a significant part of the future of how we collectively think through the kinds of challenges that people have posed today, which are deep and broad and are in many ways getting larger. So unless anyone has any final burning thoughts that they would like to add, I'd like to call this one to conclusion. We will have this available as a recording for folks if you would like to share it with others. And please check back to the website for CrisisReady.io, and we will be in touch with everyone going forward with more events. Thank you very much.